Howdy! Welcome to our presentation on postpartum depression, presented by Logan Beverly, Tiffany Fucher, Ashley Waxman, and Sophia Zecor. Today, we will be talking about postpartum depression, what it is, how postpartum may affect you, the different signs to look for, how to treat and seek help if you think you or someone you may know is suffering from the illness, and results from our own personal research. To begin, the objective of our project was to raise awareness among pregnant women of College Station in their third trimester by 2020 in order to lower the amount of women by 10% in the state of Texas who suffer from postpartum depression between the time of giving birth and 1 year. What is postpartum depression? As defined by Medline Plus, postpartum depression is moderate to severe depression in a woman after she has given birth. It may occur soon after delivery or up to a year later. Most of the time, it occurs within the first 3 months after delivery. Postpartum depression can be a serious health issue for many new mothers, and early detection can be one of the hardest obstacles when dealing with the illness. Around 13% of women are estimated to experience this extreme mood disorder, as explained by Beck. Furthermore, 10 to 20% of new mothers experience postpartum depression inside the 6 months after giving birth, as explained by Mathy. The disorder occurs when the mother experiences symptoms of depression, such as mood swings, lack of energy, and lack of activity. The severity of postpartum depression changes from mother to mother, but it typically occurs within the time frame of birth to 1 year. Later in the presentation, we will work to determine the prevalence of postpartum depression for new mothers within the Bryan College Station community and implement programs to help increase awareness and provide more resources for women affected by this health issue.
Postpartum depression is defined as being a moderate or severe type of depression, so the symptoms associated with it can vary greatly. The moderate symptoms of postpartum depression are fatigue, loss of appetite, mood swings, and lack of concentration. The more severe symptoms are depression, insomnia, fear, and unwanted thoughts. The symptoms of postpartum depression can develop quickly after birth or may even take a few months for them to appear. If not treated, symptoms can last for months or even longer. Most women experience some sort of symptoms after pregnancy that are called the baby blues. These symptoms include mood swings, sadness, insomnia, and irritability. A lot of times, women mistake their negative feelings after birth as the baby blues, when in reality they are experiencing postpartum depression. The difference between baby blues and postpartum depression is that the symptoms associated with postpartum depression last a significant amount of time longer than the baby blues. There are a lot of reasons that women experience postpartum depression, but the most common cause is physical changes a woman experiences after birth. The physical changes that occur are due to a dramatic drop in hormones, such as estrogen. The drop in hormones contribute to depression and fatigue. Other causes are lack of sleep, changes in social and work relationships, as well as fears of being a bad mother. A lot of emotional issues can cause postpartum depression, such as anxiety. Most mothers experience anxiety at night, worrying about their newborn, and their ability to be a mom. These thoughts lead to troubling sleep patterns, which can lead to insomnia. While being a new mom is hectic, having postpartum depression can prevent a new mom from taking care of not only the baby but also herself. Experiencing postpartum depression can leave some women feeling confused or embarrassed for having symptoms, so they are less inclined to get help. The majority of new moms are in denial about their symptoms because they want to be able to take care of their newborn. But in some severe cases, the symptoms associated with postpartum depression leave new moms unable to care for their baby due to emotional and physical issues. There are a lot of causes to postpartum depression that can lead to some troubling symptoms. No matter the severity of the symptoms, it should not be taken lightly, and it is encouraged for women who are going through postpartum depression to seek help from their physician or local resources.
There are certain risk factors that increase postpartum depression, such as if the woman is under the age of 20, if there is alcohol consumption, drug abuse, if it is an unplanned pregnancy, if she is experiencing anxiety, if it is a stressful pregnancy and/or delivery, and if there is little support from her family. Postpartum depression is more prevalent than most people think it is. According to the CDC, they report that approximately 1 in 9 women who give birth experience postpartum depression in the United States. And according to Evans, about 17% of mothers in Texas experience postpartum depression. In the interview conducted with Ariana Ramirez, she explained the possible severity associated with postpartum depression and how education on the topic should be more obtainable. For the interview, we were emailed responses to the questions from Ariana Ramirez. Now we will read through some of the questions and her responses. In words, can you explain what postpartum depression is? Postpartum depression is a mood disorder that can affect some women after childbirth. Patients with postpartum depression can experience feelings ranging from extreme sadness to anxiety. Postpartum depression requires medical attention and continuous care, postpartum through doctor follow-ups, medication, and/or counseling. How common is postpartum depression among women? According to the American Psychology Association, about 1 in 7 women experience postpartum depression after delivery. What do you think the severity of postpartum depression is for pregnant women? Postpartum depression can be devastating to mothers. It can cause feelings of being a bad mom, sleep deprivation, overwhelming anxiety, and suicidal thoughts. Couple this with taking care of a newborn, and it can just go downhill from there if not taken care of. How prevalent is postpartum depression in the College Station, Bryan area? I can't say for the area, but at the prenatal clinic we get an estimate of about 10 to 15 women a year. How does postpartum depression impact society? If left untreated, it can affect the patient for months or years. This can lead to the mother not connecting with her baby and interfere with her parenting abilities and keep her from her long-term goals such as going back to work and raising good kids. How does postpartum depression impact friends and family of women affected? This depends on how accepting the family is. In some cultures, depression is seen as a fault in the person, not a medical condition. For these patients, seeking treatment becomes much more difficult. The patient's family should be understanding and encouraging, although they also may have feelings of sadness. No one wants to see their loved ones suffer. The patient's partner may also suffer emotionally due to having to do the work of 2 parents if the mother is too depressed to take care of baby or even herself. In your opinion, if women suspect they are suffering from postpartum depression, what steps should they take to help themselves? Make an appointment with your doctor right away. Seeking help is the first but hardest step to take. Be honest about your feelings. You're not crazy. Also, be compliant with treatment. You will most likely not feel better right away with counseling or medication. Treatment takes time and commitment.
During the course of this online survey, a total of 15 mothers participated in this activity. These numbers were lower than anticipated due to the difficulty of obtaining participants. Most women who participated in this survey were 30 years and up, with the variance of 1 mother between the ages of 25 and 30. The ethnicity of the women ranged between white and Asian Pacific Islander, with 80% of the participants being white and 20% being Asian Pacific Islander descent. Education level ranged between bachelor's degree, master's, PhD, and doctoral degree. The mothers with bachelor's degree made up 6.6% of the participants, master's degree made up 20%, PhDs made up 60%, and the doctoral degree 13.3%. The surveyed women's occupation status is as follows. 73.3% were full-time, 13.3% were part-time, 6.6% were on part-time leave, and 6.6% of women were currently not working. The average income of the participants showed that 26.6% of the women made greater than $150,000, 20% made between $100,000 and $150,000, 13.3% made between $75,000 and $100,000, 20% made $50,000 and $75,000, 6.6% made between $25,000 and $50,000, 6.6% were unsure of their income, and 6.6% chose not to answer. Upon completion of this survey, the following questions were answered, and the results were as followed. When asked how often the mothers had felt down, depressed, or hopefully after the birth of their child, 53.8% said rarely, 23.1% said sometimes, 7.7% said often, and 15.4% said never. Since the birth of the baby, mothers were asked how often they had felt little interest or pleasure in doing things. 23.1% said rarely, 23.1% said sometimes, 15.4% said often, and 38.5% said never. Mothers were further asked if they had suffered from an unusual stressful situation such as family illness or lost one. They responded with 21.4% said yes. Furthermore, mothers were asked if they had any thoughts of self-harm. 7.1% said yes. Lastly, when asked participants would be interested in talking more about postpartum depression, 21.4% of the women said yes. In the graphs below, it shows all of the data analysis that we did. Furthermore, our last couple slides just show resources available for women, such as the prenatal clinic in Bryan, Texas, Mom's Mental Health Matters website, College Station Medical Center, and St. Joseph Health in Bryan, Texas.
One of the questions asked on the survey was, since your new baby was born, how often have you had little interest or little pleasure in doing things? The chart below displays data from the responses received. Another question asked on the survey was, would you be interested in talking more on postpartum depression? The chart below displays the data from the responses received.